Primary care is one of the largest employers within the healthcare system.
There are 350 roles in the NHS, and the most incredible thing is there is an apprenticeship for each and every one of them.
The demand on our services is growing, so we need to grow our own staff. Digital transformation, quality and change roles, administration through to management and leadership, and also your support functions such as human resources, accounts and finance, and the list is endless.
The nursing associate role was really developed to provide a robust career pathway for care assistants and for those to support nurses and for our future workforce, really.
What I love about the idea of people learning on the job and in the environment is all the soft skills, all the invaluable things that an apprentice will pick up.
One of my colleagues came to me and told me about the apprenticeship and that she'd put my name forward. My eldest is just about to start secondary school, so if I'm going to do it, now's the time to do it, and I'm really pleased I have.
I found out through work. When I applied for the practice manager's job, I was very conscious that I'd never done that sort of role before.
My children are about to attend university themselves. I couldn't see a reason to avoid going to it. And actually everything was directing me to it, and the intimidation of feeling that advanced clinical practitioner was beyond me was my own personal feeling at that moment, when actually I can achieve it and I can do it and I want to do it and I want to achieve it.
At first they approached me and they said, look, we really think you'd benefit from this. We'd really like to put you on a contract. When they offered me a chance to finish uni, come straight into a job, working full time and still earning another qualification, it seemed like a no-brainer to me.
I have been recently mentoring our reception supervisor, and she is one of the people that has started an apprenticeship scheme, and she's only been doing it for 2 months, and you can already see a change in the way that she manages her team.
And is now, running a lot more than she was previously, so it's really helped her further develop herself. And if we hadn't have had that, I think she may have been bored in her current role, and we perhaps would have lost her.
I think a lot of people leave sixth form and college now and they are really lost. They feel that pressure to go to university and to just do a degree, whether they know exactly what they want to do or not. And the apprenticeship route is a great way to say to them, it's okay to not know what you want to do. Let us support you within that and show you what general practice has to offer.
The biggest one is probably the development and the implementation of our new duty team. That was a big challenge, and it was good fun.
Abby absolutely loves date check-in, and it's something that she has made her own.
Actually, there is very little additional cost to doing an apprenticeship. So a lot of the time the course itself is fully funded. There may be a 5% cost, but sometimes that's covered through the levy transfer scheme. And the only cost to the practice is the salary, and 9 times out of 10 you would have already had to pay that salary out, whether that be to somebody who's qualified or not qualified yet.
Which actually means that we don't have to, we can focus then on the actual person and their development.
Pharmacy technician training is a 2-year training programme, and it's run usually as an apprenticeship.
So with my apprenticeship, I have 20% of coursework time. In my workplace, I work 2 days within the pharmacy, and then I have 3 days up because I'm doing a pathway that's with the PCN.
I have access to Buttercups. It's called a one file, which is all online, and that's all sent through to me, so I know exactly what she should be doing. So when we have our review meetings, we can go through points that she should be doing.
It can be difficult. The workload is quite apparent. I'm really lucky in the fact that I can spend 2 half days where I spend my time at home and I do my studying from home. So it just takes me away from the distractions of being at work.
It's very important that the person that takes on the role is self-motivated, wants to learn.
Plan your days and your weeks. I actually am in the habit of planning my days, specifically what I'm going to do, and it helps me stay on top of my reception workload, my operations workload and my apprenticeship.
So I think for other practices who are interested in investing in apprenticeships would be to contact their workforce support lead within their PCN. There's a training hub with apprenticeship lead to talk to them, and also to talk to local colleges.
Help is available in our area across the Thames Valley. So if you need to attain your maths and English, if you were not able to achieve the grades at GCSE, it really is not a problem. Contact your local training hub.
I think the benefits of having an apprentice is several, really. It's good for retention of the workforce. Generally, I think it's just a culture of learning from each other, which is really good, actually.
I'm looking forward to being able to serve my community and to serve the patients with the skill set that I have.
As they develop, they start to generate more ideas, they start to think about doing things better. The whole thing just becomes this wonderful sort of snowball of positivity, actually.